You've probably heard the phrase trauma informed. Therapists say it, schools say it, even workplaces say it. But here's the question: what does trauma informed actually mean? And how do you know if someone truly practices it, not just claims to? Today, I'm going to break down what trauma informed care really is, how to recognize it, and what questions you can ask before trusting someone with your story. Trauma informed care is an approach used in healthcare, counseling, education, and social services that recognizes the widespread impact of trauma and actively works to avoid re traumatizing people. The U.S. Substance Abuse and Mental Health Services Administration, or SAMHSA, describes trauma informed care using four key assumptions. A trauma informed professional, one, realizes the widespread impact of trauma, two, recognizes signs and symptoms of trauma, three, responds by integrating trauma knowledge into their practice, and four, actively works to resist re traumatization. In other words, trauma informed care shifts the question from what's wrong with you to what happened to you. This shift changes everything about how someone approaches helping others. The core principles of trauma informed care. So, trauma informed care is guided by six core principles. Those include safety, that people should feel physically and emotionally safe, trustworthiness and transparency, so providers and professionals are open about what they're doing and why, peer support. Healing often happens through connection with others, collaboration, and mutuality. The professional is not the authority over your life. Healing happens through mutuality and partnership. That goes along with the fifth aspect, which is empowerment, voice, and choice. Your preferences, your autonomy should matter and should be what is driving that care. Sixth, cultural, historical, and gender awareness needs to be a core consideration. Professionals consider social context, identity, and systemic trauma. These principles emphasize something extremely important: that you, the client, the patient, remain the expert on your own experience. A major sign of trauma informed practice: a truly trauma informed professional never, ever pressures someone to disclose trauma details before they are ready. Why is this so important? Because trauma informed care prioritizes safety, choice, and empowerment. So, allowing individuals control over what they share and when is hugely important. If someone is pushing you to tell your trauma story or to give unnecessary details or insisting you must talk about it before you're ready, that is not trauma informed practice. Choice and autonomy are central to trauma informed care. Anyone can say that they're trauma informed, but a truly trauma informed practice usually shows up in their behavior. Here are some of the signs that you can look for. They prioritize safety, not just physical safety, but emotional safety. They check in about your comfort level and they respect your boundaries. They don't put additional pressure for you to move your boundaries. They offer choices. And instead of directing you, they present options. They collaborate with you, which means that they also listen. You help shape the goals and direction of your care. This will feel a lot more like partnership than someone else leading or directing you. Trauma informed professional will move at your pace with what you are comfortable with. You will not be rushed into sharing painful details. They will always explain what they're doing. And if you're ever confused, you can ask a question and it will be well received and you will be given a clear explanation. And they will care about whether you have come to a true understanding. Transparency builds trust, and a trauma informed professional will take the time to do that. If you feel pressured, judged, rushed, that is a signal to you that something may not be trauma informed. Here are some questions that you can ask. If you're looking for a therapist or professional that you want to know if they're truly trauma informed, you can ask, how do you ensure clients feel safe during your sessions? Or what happens if I'm not ready to talk about certain experiences? Or how do clients participate in deciding treatment goals with you? What trauma specific therapies do you offer? And how do you prevent re traumatization in your work with your clients? The answers to those questions should reflect, again, choice, collaboration, and respect for you, your needs, your safety, and the pace that feels right for you. Trauma informed professionals may use trauma specific treatments, meaning therapies designed to help people recover from trauma. Examples of this can include EMDR, or eye movement desensitization and reprocessing, trauma focused cognitive behavioral therapy, so trauma focused CBT. It could also include somatic or body based approaches. Other approaches might include stabilization and nervous system regulation. But the key point is that trauma informed care is not a single therapy, it's a way of being and practicing with traumatized person. It shapes how professionals interact, not just what techniques we use. If you take one thing away from this video, let it be this: trauma informed care is about restoring control, giving control back to the traumatized person. And the goal is to create an environment where people feel safe, respected, and empowered to heal at their own pace. You should never feel pressured to share something before you're ready, because your story belongs to you, and any trauma informed professional will treat it that way. If you enjoyed this video or found it helpful, please give it a like, subscribe, and share it with a friend who you think might need it.